So reduce the risk of diabetic ulcerations by providing the patient with a step count. That's awesome. Okay. Real-time audiovisual alerts of plantar pressure may cause tissue damage, and providing us as practitioners real-world pressure, adherence, step count, and temperature data. It's all in one. Okay. Now look at that's an example of an insole in the left-hand corner there. You can see it's not very thick. There's not a lot of diameter there, but it actually enabled us to now have a powerful tool in our armament against these diabetic foot ulcerations for these patients. Next slide, please. So let's talk about user flow. Okay. Patient gets the insoles. I tell patients, hey, take it easy for a little bit. Get to familiarize yourself with the technology. Put it in your shoes. Make sure that you're charging them. Okay. They have a charger that's extremely easy, or any charger that you might use, you're going to have, it's very easy to use. So where's the remote patient monitoring the insoles? Patient receives alerts based on the sensor data, modifies the behavior. Okay. Patient, that's key. Patient does. All right. The data then is uploaded to the cloud, and then the data is monitored by the dashboard, the healthcare provider, and then CPT eligible, like Dr. Lehrman's going to allude to, and he's touched upon a little bit later on. Next slide, please. So let's talk about the stack. Okay. When I say the stack, you're going to be surprised when you get your hands on these how thin they really are. The last thing we want patients to do is to shove these in, or shove an insole in a shoe or diabetic shoe that's too thick or it's too high. That's going to cause the patient to have problems later on and cause ulcerations maybe on the dorsal aspect of the foot. These are extremely thin, and it also has a wireless charger as well. So it enables the patient to take some time to charge it, and they can drop it right in their boots at night. It's very, very simple, especially if they're working in an environment like that.